Welcome to the Children's TherAplay Foundation. We'd like to thank you for being here today. It's because of volunteers like you that we are able to help children with special needs live life to the fullest through equine-assisted physical and occupational therapies. Thank you for helping make that possible. Now let's take a look at sidewalking and hippotherapy during the kiddos' physical and occupational therapy treatments. The term hippotherapy is derived from ancient Greek with the prefix hippo, meaning horse. Hippotherapy is a treatment strategy that uses the movement of the horse to improve coordination, strength, and balance. Several team members are required in order to make a therapy session possible. The horse handler directs the horse in the movement patterns requested from the therapist. The therapist is responsible for developing a treatment plan that utilizes equine movement in an effective way to meet therapy goals. The therapist collaborates with all team members to ensure a safe and effective treatment session. The sidewalker assists at the direction of the therapist, helping transition on and off the horse, helping maintain patient position on the horse, assisting the patient with activities while on the horse, and obtaining or handling equipment needed by the therapist during the session. The first step in sidewalking is helping the child on the horse. It is important to make sure the transition onto the horse is quick, smooth, and safe to start off the therapy session successfully. Once the child is on the horse, the therapist may ask you to place your hand on either the child's thigh, knee, or ankle, depending on the level of support the child needs. Please be careful not to lean on the horse while providing support to the child. There may be several different transitions during the child's treatment. It is natural to want to assist the child from one position to another, but since the child transitioning independently may be part of therapy goals, be sure to ask the therapist first. The therapist may ask the child to sit sideways, balance on hands and knees, or even stand on the horse. During these transitions, the therapist will provide you with instructions on where to place your hands. What if you're unsure of appropriate hand placement? Feel free to ask the therapist, "Where would you like me to place my hands?" The therapist may also direct you to help with games and activities on the horse. Activities commonly used during treatment are passing rings, stacking cones, and searching for litters on the wall of the arena. The therapist will provide you with instructions on how to help during these activities. Although the kiddos are super sweet and fun, please remember they are here for a medical treatment. Unless the therapist asks you to interact with the child as part of the therapy session, please keep talking to a minimum. That way the child can stay focused on the treatment. The therapist will direct the child in how to dismount the horse when the therapy session is complete. The therapist will most likely ask the child to lean forward and swing the leg nearest to the sidewalker over the horse's rump. The therapist will then support the child at the waist or under the arms to lower down from the horse. Horses are flight animals and can become startled by unexpected sounds, objects, or other occurrences. If a horse spooks during the therapy session, the sidewalker should help transfer the child into the therapist's arms as safely and quickly as possible. A sidewalker should lift the child's leg nearest to them up and over the horse while pushing the child towards the therapist. It is important that you listen for specific instructions from the therapist. Children's TherAplay is a medical facility. We take patient confidentiality seriously, so while you are encouraged to ask the therapist about the child's goals in order to promote a team approach towards the child's hippotherapy session, please do not ask about the patient's past medical history or full name, or discuss the child with other individuals. Additional information about HIPAA guidelines, which exist to ensure patient privacy, will be shared in the HIPAA PowerPoint. The kiddos and staff wear closed-toed shoes in the arena and barn. You should as well. Please choose tennis shoes or boots that will allow you to keep up with the horse or even jog for a short period of time on uneven terrain. Our therapy horses are colleagues. Actually, they're family, and we treat them with kindness, courtesy, and respect. Do not sneak up on them. Let them know you're there. Speak softly and calmly to the horse before entering or touching them. Before entering the arena, look to make sure any horses are several lengths away from the door. Then gently open the door and call out, "Door!" so everyone is aware of your position. Walk in slowly and shut the door quietly behind you. Please help keep our horses healthy and happy. There are times it's okay to give our horses treats, but remember to always play it safe and ask permission and assistance from our barn staff. When petting a horse, ensure your safety by keeping your fingers away from the horse's mouth. They look a lot like carrots. That's it. Now you've completed the video. We'll take a few moments to walk through everything in person and answer any questions you may have. Once again, thank you for being part of Children's TherAplay. You're helping make a world of a difference for these children and their families. We're so glad you're here.